In this video today, we talk about the smart choice of when is ketamine a treatment that you should use and how to stay safe. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand how and when to deploy options that can help them deal with mental health, physical pain, and other aspects of health so they can be able to lead their best lives. Today, we're talking about a continuation of a video that we put forth previously just discussing Matthew Perry and his ketamine usage and subsequent passing. And so what really has been present is that ketamine is a drug that is unsafe, shouldn't be used, and shouldn't give any degree of benefit for patients. And we know that ketamine can be seen in a lot of different formulations. It can be given in an IV formulation. When you take a look at it from a molecular chemistry vantage point, it looks like the following. So when we think about ketamine, is it useful for the vast majority of patients? And we're going to talk about that. But getting into specifics of the case, so Matthew Perry himself had a number of issues, specifically depression, that we talked about previously. And what took place is it's a little bit confounding. It's not really that clear. What we see is that, per the report, he's had high levels of ketamine in his blood, and he lapsed into unconsciousness and then went under the water. And stated here was that he'd been receiving ketamine infusions for depression and anxiety, but the medical examiner states the ketamine in his system at death could not have been from the infusion, which is what we discussed before, because ketamine in IV formulation, its half-life is 3 to 4 hours at max. Or as we kind of know, that IV formulation is not going to be something that's going to last for this period of time. So traditionally, there had to be another formulation that was utilized. The doctors that were involved with the case have been documented throughout. So these are going to be the two different doctors that I've mentioned previously. I can't really be able to speak to whether they did things that were incorrectly or not. I don't know all the details of the case, and I won't go into that vantage point. But as a patient, people would say, well, I don't know if it's really worth it for me to consider doing something like this. Why should I even use ketamine if it's potentially unsafe? So let's kind of give you some more insight about that. So traditionally, when we talk about ketamine that's used in a regular traditional clinic formulation, what we're talking about is an IV or liquid formulation. We talk about illegal. One of the things that we see is that it's traditionally a powder. So you can see here how's it taken and what's the law around it. For medical use, ketamine's liquid. That's what we use in anesthesia to be able to put someone off to sleep and then be able to wake them back up. When we talk about street drug, it's a grainy white powder. So in 1989, ketamine became a Schedule III or non-narcotic substance that's been ruled. And in 2019, they've approved another version of the drug for treatment-resistant depression that can be used in an office or in clinic. So different formulations matter. And so why is that? Is because how you experience. So this table can be a little bit confusing, the next slide, but let me explain it so you get it. So there's different formulations, as I mentioned before. There's intravenous, there's intramuscular, there's intranasal, there's rectal, oral, and then there's this powder formulation, which we really don't know anything about in terms of how quickly and how it affects people. Bioavailability is when that medicine or any medicine is given. How soon is it available versus how, is it eliminated by the liver and the kidneys and things like that? As you can clearly see, the IV formulation is available in its fullest amount. When you look at these other different formulations, whether it's intranasal, so either traditional or things like Spravato, which is the medication they mentioned that was recently formulated and put forth, you can see there's a difference in terms of how much is actually available and present to be able to be utilized. But at the end of the day, that bioavailability affects dose, and it affects how that person experiences that dose. So when we think about, is this something that's really safe? It's a little bit more convoluted. So let's get into that. So when we talk about ketamine and its illegal use, what we see is that ketamine in 2023 was found to have increased in its prevalence. And what law enforcement agency had seized more than 1,500 pounds of ketamine in 2022, which is 12 times more than 2017. The most prominent states for this were Tennessee, Florida, and California. However, What this is most likely is the powder form, that form that's the illicit substance that is referred to as Special K, not the medical grade IV or liquid formulation, which really needs to be distinguished. And why is that key? As you can see in this last paragraph, is the illegal formulation or powder form can be contaminated, can be mixed with things like fentanyl, which then becomes much more risky and much more problematic. I don't know, and I'm not speculating that that's what Matthew Perry had. But what I'm saying is when you're looking at this as a patient that's considering potentially ketamine for your benefit, there's a few things you need to understand. And some of that basically revolves around, is this appropriate? Is this the traditional IV utilization? And pretty much every clinic that's out there is going to be utilizing that formulation. And why do I say that? Because what we do is we look at it compared to weight and dose and problem. And when you look at those things, that's how you are able to initially determine safety, number one, and number two, efficacy. So efficacy being how effective is it going to be, and what do you need to do in order to be able to get a better effect, but do it in a safe manner. So when we talk about really how many people have died from ketamine use, one of the things that we see is that traditional illicit substances like cocaine, heroin, and other opioids, they actually report those to the CDC, and ketamine is not. But what we believe is the number is incredibly low. Like when you look at fentanyl in 2022, it killed almost 74,000 people, and ketamine is not close to that. So as a public issue, it's not really that prevalent. But we're going to talk about how you can be able to protect you and the people you care about if you were to choose it. So many people are like, yeah, with all that, I'm not even sure. Why would I even pick ketamine as a potential option for value? So when we think about ketamine and its value, we can see that its use has increased markedly in traditional medical validity. And so why is that? Because it has been helpful for a number of conditions. It's been helpful for treatment-resistant depression, meaning depression that doesn't traditionally respond to medications. It's been useful for PTSD. It's been helpful for postpartum and peripartum depression, anxiety, traditional substance abuse disorders, eating disorders, and chronic pain. So all those things have been prevalent with responding to ketamine. And people would say, yeah, I still am not so convinced. Well, let me give you this slide. So when we take a look at the aspect of antidepressants, traditionally when we see this is that it can take traditionally anywhere from 2 to 3 months to be able to get a response from an antidepressant type of medication. Ketamine can give you that response sometimes within 24 hours. And some people are like, well, that's not necessarily good. What can be good, particularly for some people who have suicidal ideation and tendencies, who are worried and concerned, and if they're done and treated in an actual secure medical environment, you may be able to save their life and prevent them from having problems and issues that you couldn't with a medication that's going to take you 2 to 3 months to be able to utilize. In addition, there's been utilization by a number of different kind of high-profile figures, people like Larry Odom and Elon Musk and other individuals, which doesn't necessarily make it right. But we do know that safety has been prevalent when it's done correctly. And we're going to talk about that. So what do you need to do in order to be able to assess what's correct and what's not? Traditionally, there's been a statement that's been put forth that the lethal dose of ketamine is 5.6 milligrams per pound for a 154-pound human, right? Well, I think it's more complex than that. And particularly coming from an anesthesia background, let's talk about that in a little bit more depth and detail. So traditionally, when we put someone off to sleep, we only use a certain amount. When we look at depression, we can range anywhere from 0.3 to 0.7 milligrams per kilogram. And so kilograms, as you guys know, is very much a different utilization of traditional standard units versus pounds. But at the end of the day, we're looking at it based off of someone's weight. When we think about traditional pain done in an outpatient clinical setting, we'll sometimes use 1 milligram per kilogram of ketamine in order to be able to provide relief. But then when we really kind of think about this, have we thought about doing higher doses? And we have. And I've done it myself as a fellow in New York. One of the things that we did is we brought patients into the ICU setting. We put them off to sleep and we gave ketamine for something that's called complex regional pain syndrome. So it's a type of pain that's resulting from a nerve injury that's significant in nature. And these patients hadn't been able to get relief from a whole host of different things. And this is a super high intense utilization of this medication, but in a completely monitored setting with medical staff that's present. So when we talk about that context, one of the things that we can see is the following is, so this is a meta-analysis, which if you guys follow our channel, it basically looks at a number of different papers, and they looked at ketamine infusions for complex regional pain syndrome and what were some of the high doses that were utilized. And what they were able to say and see is that there is ranges from 0.15 milligram per kilogram all the way up to 7 milligrams per kilogram. So not just 1 milligram and not just 5 milligrams per kilogram, but 7 milligrams per kilogram in terms of utilization. And actually, there are doses that ranged higher than that. So when they looked at pain relief that was significant, what they found is that for complex regional pain syndrome, which is really one of the toughest traditional treatments, or rather traditional injuries and issues that exist to treat, what they found is that those individuals who had a course that was present of pain relief that provided relief for 6 to 3 months, or rather, pardon me, 3 to 6 months from a one dose. And what they were using is 15 to 20 milligrams per hour over the course of 10 to 20 days. Now, the thing is, when you look at this doesn't kind of tell you what the pound component is, but nonetheless, we can be able to kind of speculate that there is reason and rationale for why you can use ketamine and use ketamine safely. Ketamine previously has been used years ago on the battlefield, mainly because people didn't stop their breathing with ketamine utilization for the most part. It actually promotes tachypnea, or increase in respiratory rate. In addition, it can elevate your blood pressure and elevate your heart rate, which is useful if someone has an injury and they're potentially going to go into shock. This can prevent them from being able to go into shock. Not needed and utilized quite as much, because the fact of the matter is, when you use ketamine in high doses, you can traditionally see this dissociative effect where someone has this experience, this kind of outer body, and you don't necessarily want that, even though you might be able to kind of prevent them from having pain and saving their life if you don't have other medications. So it's kind of fallen out of disfavor in the battlefield quite as much, but it still can be utilized in that context. At the end of the day, how do you keep yourself safe? And one of the ways to be able to do that is by using monitoring. It's what we do in anesthesia. It's what every clinic does that's actually appropriate and safe. And what you want to do, and most clinics will say, oh, we'll take a look at the heart rate and we'll take a look at the pulse ox. And so the heart rate is going to give you an idea about how fast your heart is going. The pulse ox is going to give you an idea about what your oxygen saturation is. And if you can take a look in this picture, you'll see the 80 is your heart rate. And the pulse ox is going to be that 98 or yellow number that's present. In between that, you can see a number in red that's 126/83. And as most of you have probably already kind of deduced correctly, that's a blood pressure, right? And so you want to be able to take a look at all three of these numbers. But if you really want to have some of the best safety and present, what you want to consider doing is end-tidal CO2 monitoring, which you can see at the very bottom, this number 29, and this little graph that's here. Well, why? What the heck is that? It's actually showing your breathing pattern. And you can see that change in the breathing pattern many times before you see a change that happens with your pulse ox, which is indicative of the oxygenation in your blood. By the time you sometimes see that number change significantly, you're kind of behind the 8 ball. So a little clue for patients that are looking to be able to differentiate between one clinic versus another is, yes, they certainly should be managing and evaluating the heart rate, blood pressure, and pulse ox. Those are kind of standard, and you'll see that in most indications for how to be able to do this safely. But if you really want to kind of push it a little bit further, one of the things to consider is possibly end-tidal CO2 if you are at risk. And so who is an at-risk population? One, if you're receiving a high dose of ketamine, not necessarily the lower doses that you might be using for mood disorders or possibly for PTSD. But two is if you have issues like sleep apnea, respiratory problems, that certainly can predispose you to having issues. But let's talk about, are there places that physicians are able to be evaluated, assessed, be able to be taught how to be able to take care of patients and treat patients better? And if you know I'm asking this question, you know I have the answer. And yes, that's the case. So there's an entity that's called the American Society of Ketamine Physicians, Psychotherapists, and Practitioners. One of the things that you can do as a patient is to go to the actual site and take a look, because you can be able to see who are the members of this. You can see a directory that tells you who's closest to you. But what do they do? So what they do is that they're a nonprofit group that looks at how can you use ketamine for mental health disorders and pain. And they put out different statements that'll let you be able to identify, both as a patient and as a healthcare provider, how to be able to be safe. And one of those statements is the following. So first, you have to look at the patient and whether they have potential issues to make sure that they're safe if you're going to provide ketamine. So you want to look at, do they have cardiac issues? Do they have high blood pressure? Are they going to be able to tolerate some of those effects that take place with the heart and the vasculature system? You want to make sure you have supervised administration, which is what I said before. And so you want to have monitoring that is present so that you can intervene and change things, stop that medication that's being given or reduce the dose if there's a problem or issue. And then in addition to that, you also want to track how that person responds. 3, you want patient education. As a patient, you don't necessarily want to come in and just have something take place and then get sent home and not have any idea about how that's affecting you. You want to be able to understand exactly what's the indication, how you're going to get a response, and then if that doesn't happen, then what are we going to do next? And then you want to talk about team engagement, where you have the utilization of multiple different types of disciplines that are in place that can be able to provide not only the medical component, but also if you're treating mental health, how can you be able to utilize someone who can provide you value? And then finally, that monitoring portion that I talked about before, which is being able to kind of see what's happening with that person and making sure that they're not having any problems or issues. So if I was giving you 3 good rules on how you can be able to evaluate a ketamine clinic and be able to see, is it safe, is number 1, are they part of any type of affiliation like American Society of Ketamine Physicians that basically gives updates on how to be able to see, are you doing things right? What are the new standards? Have they reviewed the research and been able to kind of distill that to their various different providers? 2, are they providing you the utilization of monitoring in the setting after they've assessed that you're a safe candidate, and monitoring being things like heart rate, blood pressure, and pulse ox. And if you're trying to put a cherry on top, that end-tidal CO2 to see what's going on. And then number 3 is, are those providers able to do something about what happens if you were to have changes in that monitoring? And not every provider is capable of that. And that's a question that you need to have with the person who's taking care of you. Hopefully you found this video helpful. If you did, please hit the like button. If you're interested in knowing more things about what are your options and how to be able to be safe with getting those options for your mental or physical health, please hit the subscribe button so you can find more videos like this, and take care and have a great day.